All right, let's talk about something that affects millions of people, chronic pain from osteoarthritis. There's some fascinating new research out there that could be a real ray of hope, and we're going to dive right in.
So here's the big question, right? Could a therapy we usually think of for fighting cancer actually be a new weapon against arthritis? I know it sounds a little strange, but a new study is suggesting exactly that. And the results, well, they're pretty compelling.
Okay, but before we jump into the brand new science, we really need to get a handle on the problem it's trying to solve. I mean, for millions of people, osteoarthritis isn't just some minor ache. It is a daily dilemma, and honestly, the options on the table right now, they're not great.
And just to put a number on it, we're talking about roughly 33 million adults in the United States alone. This isn't a small problem. It's actually the country's leading cause of disability. It's what happens when that protective cartilage in our joints just gradually breaks down over time.
Right now, if you're patient, you're pretty much caught between a rock and a hard place. On one side, you've got medications, like NSAIDs. Sure, they can help, but they come with some serious risks if you use them long term. And on the other side, you've got invasive joint replacement surgery. I mean, that's a huge deal, a total last resort. So there's this massive gap right in the middle. And with everyone worried about opioid dependency and the super long, expensive recovery from surgery, well, millions of people are just stuck.
So you have to wonder, right? Could there be a third option, a non-invasive treatment that fills that gap? Well, that's exactly what researchers are looking into. And it brings us right back to that surprising therapy we hinted at. It's called low-dose radiotherapy, or LDRT for short. Now let me be super clear here. This is not the same thing as radiation for cancer, not even close. Instead of these massive doses that destroy cells, LDRT uses tiny, really targeted doses. The whole idea is to just calm down the overactive immune cells right there in the joint. This creates this powerful anti-inflammatory effect that gets right to the source of the pain.
Okay, so the theory sounds great, right? It's promising. But the big question is, does it actually work in the real world? Well, to find that out, a brand new clinical trial from South Korea decided to put LDRT to the test.
Here's how they set it up. They took 114 patients, all with knee osteoarthritis, and randomly split them into 3 groups. You had one group that got a higher dose of LDRT, another that got a super low dose, and then a third group that got a sham treatment, basically a placebo. They went through all the same motions, but they didn't get any actual radiation. Now, here is what I think is a really clever part of this study's design. To make sure they got a crystal clear result, the researchers asked the patients to stop taking any strong painkillers. And this is so important, right? Because it means that any pain relief they saw was almost certainly from the radiation itself, not just being masked by other drugs. And the results? Honestly, they were pretty striking. After 4 months, 70%, that's 7 out of 10, of the patients in that higher dose group said they had significant improvement. Now compare that to the placebo group, only 41% of them improved. That difference, that's a huge signal. It shows a really clear, powerful effect from the treatment, way beyond what you'd ever expect from just a placebo. It's also really interesting that the group that got the super low dose, they didn't really see a benefit over the placebo. So what does that tell us? It tells us that the dosage level is absolutely critical. Getting it just right seems to be the key to making this whole thing work. Okay, so a 70% response rate. That's impressive stuff. But what does this actually mean for, a real person dealing with this pain every day? Let's break down what the real-world implications could be.
So who is this for? Who's the ideal patient here? Well, the researchers think it's for people with mild to moderate osteoarthritis, so not the most severe cases, where the joint structure is still mostly in good shape. And for people who just can't tolerate other medications or who are really trying to avoid surgery, this could be an absolute game changer.
And this, right here, is probably the biggest deal. The lead researcher said it himself. For the right person, this kind of approach could delay the need for joint replacement surgery, maybe by years. Or, who knows, maybe even help them avoid it entirely. Now that would be incredible. Of course, the second you hear the word radiation, a big red flag goes up for most people, right? One question immediately pops into your head. What about the long-term risks? What about cancer? And that is a totally valid, super important concern that we have to talk about.
So researchers have definitely looked into this, and while, there's a theoretical risk, there always is, several past studies have actually looked for an increased risk of cancer after this kind of low-dose therapy, and they haven't found one. Now, just to be on the safe side, one expert who wasn't part of the study suggested that maybe this treatment is best for patients who are, say, over the age of 60.
Okay, now before we all get too excited, we have to pump the brakes for a second. There's a really important catch here. These findings are brand spanking new, so new that they haven't even been published in a peer-reviewed journal yet. What that means is they're still preliminary. They need to be checked out and confirmed by other experts in the field.
All right, so keeping that in mind, let's look to the future a bit. Let's say these results do hold up. What could this mean for how we manage chronic pain down the road?
So, what are the big takeaways here? First, this LDRAT could be that middle ground option we've been looking for, something non-invasive, sitting right between pills and major surgery. Second, you can imagine it might work even better when you combine it with other stuff like physical therapy. And finally, it's just a totally different way of thinking about how to manage a condition that, let's face it, affects millions and millions of people.
And that really leaves us with one last thought to chew on. This research takes the therapy that's been around for ages and just applies it in a totally new way to tackle a very, very old problem. It really makes you wonder, doesn't it? What other therapies that we already have could be repurposed? What other breakthroughs for our most common chronic conditions might be unlocked just by looking at old tools in a new light? The answer could be hiding in plain sight.